Assalamu alaikum dear viewers. In this video I will tell you about 5 million feared sick over next 12 weeks in flooded areas due to disease outbreak. Before telling about this news, I will request you to please subscribe my channel Apna Punjab and press bell icon so you can easily receive the notification of our upcoming and interesting videos. People likely to get diarrhea, cholera, gastroenteritis, typhoid, dengue, and malaria. Children at risk of getting measles, which can spread like fire among the displaced populations, and polio. A disease outbreak would initially require medicines and medical supplies worth rupees 1 billion. Health experts have sounded the alarm regarding the outbreak of disease in flood affected areas, estimating around 5 million people to fall sick in the next 4 to 12 weeks. The news reported. People in the flooded areas of Sindh, Balochistan, southern Punjab, and Khyber Pakhtunkhwa are likely to get diarrhea, cholera, gastroenteritis, typhoid, and vector-borne diseases like dengue and malaria, the health expert warned on Tuesday. It is estimated that a disease outbreak would initially require medicines and medical supplies worth rupees 1 billion. They said and urged donors, philanthropists, and common people to donate these after consulting health experts and officials of rescue and welfare organizations. Of the 33 million people affected due to monsoon rains and flood across Pakistan, it is estimated that around 5 million people, including children, would get sick due to outbreak of waterborne and vector-borne diseases in the next 4 to 12 weeks. As there is no clean drinking water available in the flood-ravaged areas, there is a risk of outbreak of diarrhea, cholera, typhoid, gastroenteritis, dengue, and malaria. Renowned public health expert and Vice Chancellor of the Health Services Academy HSA Islamabad, Dr. Shahzad Ali told the news on Tuesday. He said children will be more vulnerable due to weak immunity and warned that an outbreak of acute watery diarrhea and other waterborne diseases could kill hundreds of children and adults if immediate preventive measures were not adopted. There is an urgent need to vaccinate all the people in the flood affected areas against typhoid cholera. This vaccine is available in the country and it can be deployed to prevent deaths from typhoid and cholera in Sindh and Balochistan. Similarly, prophylactic treatment of malaria should also be started to prevent deaths from the vector-borne diseases, Dr. Khan said, urging the authorities to make anti-snake venom and anti-rabies vaccines available in abundance. He said hundreds of incidents of snake bite and dog bite had been reported from KP, Sindh and Balochistan. Former Health Director General and an expert on infectious disease, Dr. Rana Muhammad Safdar was of the opinion that children in the flood-affected areas were the most vulnerable and needed immediate medical attention, saying immunization programs of the provinces should reach out of the unvaccinated children. In addition to diarrhea and other waterborne diseases, children are at the risk of getting measles, which can spread like fire among the displaced populations. Polio is another threat, and unfortunately, we have seen wild polio virus once circulating in many cities of KP and Punjab. While it can travel to the other cities where it has not yet been found, Dr. Safdar said. On the other hand, officials of the welfare organizations working in the flood hit areas said a large number of people, including women and children, had already started suffering from waterborne infections, including diarrhea, gastroenteritis, cholera, fever, flu, allergies, scabies, and other fungal skin ailments. We also believe that around rupees 1 billion would be required initially to meet the medical needs of sick people in the flood hit areas, as hundreds of people are getting sick due to waterborne and vector-borne diseases in these areas, said Sufyan Ahmed, Managing Director of Al Khidmat Health Foundation, who is coordinating with the charity and welfare organizations for relief operation in flood hit areas across Pakistan. According to Ahmed, in the absence of any guidelines, a huge quantity of unwanted medicines were being donated, which go to waste or are misused in the name of flood victims. In these circumstances, we have prepared guidelines for relief operations with the assistance from Pakistan Society of Health System Pharmacists. These guidelines provide a complete list of medicines, medical supplies, and other stuff that is needed by the patients in distress at the moment, Ahmed said. He then referred to the guidelines which carried details of several medicines for anti-infectives, oral cough and cold preps, pain, colic, fever management, oral, pregnancy or female care, antacids, wound dressings, vomiting, nausea, oral, antidiarrheal oral and other as basic first aid supplies. The list also identified several medicine supplies for the healthcare units which are required in the flood hit areas. The health authorities, he said, were also coordinated with the local pharmaceuticals and charity and welfare organizations to help them reach out of the affected area in dire need of the medical supplies. On such engagement was facilitated between local pharmaceutical company Farmivu and Al Khidmat Foundation, and the former is provided rupees 5 million medicines to the latter for the affected areas of Sindh and Balochistan in the first phase, he said. It is a gigantic task and the government alone cannot handle the situation. So we are engaging all individual and organizations and channeling the operation for the effective results. The fresh initiative, he said, was aimed giving patients access to basic clinical services for their medical needs better than what the local infrastructure has to offer in a very disastrous situations. Thank you viewers for watching our video. So for more updates about the flood affected areas, please subscribe our channel Apna Punjab and press bell icon so you can easily receive our upcoming and interesting videos. Thank you.